talked about the out-of-control spending as you see it in Washington, D.C. What are the areas where you think you would want to chop first, or the recommendations that you would make?
Well, the first thing is I would work to have the Obamacare bill repealed and reformed. To me, I've really thought this out in my little book, Healthcare Accountability. I've thought it out. I couldn't find the people who this program, not that they weren't in my backyard, but I mean, I couldn't find people in the United States who did not have access to health care. Because I'm pretty sure it was 1986, the Emergency Medical Treatment Active Labor Act was passed. And since that time, any emergency room in the United States that accepts Medicare funding provides health care to anybody who walks in. I have a personal friend who's an ER tech in Philadelphia, and another who's the son of a good friend of mine who I've spoken with. People walk into those emergency rooms, and the hospitals are very smart. Remember, they're staying in business while taking care of this. This is money that's already being expended on health care. And if it is not a real emergency, and they check that out quite quickly, and they're not allowed to ask for payment. They cannot ask for payment before the person is treated. They send them into what they might call another emergency room, a second emergency room, which we might call a clinic. Okay, and they get they always get a sandwich, they always get a drink, and sometimes that's actually enough. Sometimes that's just enough. Sometimes they want to stay overnight. Sometimes they don't. But in the southern states, there are a lot of Mexican women who cross the border so that their children could be born in the United States and become citizens immediately, and that's part of the United States law. And so if they get themselves to a hospital, the second part of that, EMT-ALA, is Active Labor Act. That means that they get a hospital room, a hospital bed, and nobody's asking them for a dime until the baby's born and healthy, and they would be discharged as anybody else. Now, they're not even citizens, and they get health care in the United States. And so first of all, my perspective is that we're solving a problem that from the person who needs access to health care didn't exist. Now, they don't have my insurance policy. They don't have your insurance policy. And I'm concerned that this is just part of socialism. There I said it, the S word. And redistribution of health care, just like redistribution of income, and that it's not enough that they have health care. What's really important is that they have your health care, that they have health care that's exactly what you have worked for all your life, even though they have not necessarily worked for it all their lives. And I know that there's exceptions, and you get the sob story exceptions on the other side, and I'm not suggesting that there aren't people that are in bad straits. But $1 trillion? And how about the fact that there's no tort reform, and there's no buying across insurance across state lines? How about the estimated cost of defensive medicine caused by the concern for malpractice suits? I've seen statistics. I've referenced them in some of the stuff that I've written and put up on my website that indicate that if we didn't even look at saving money across state lines, that we could give everybody who does not have health care, the ones that were included in the Obamacare, everybody could get an $8,000 insurance policy per year. That if we address tort reform, defensive medicine, and the cost savings from those is enormous. We choose, tell me why, I don't know, why would we have chosen to ignore that? And my answer is that this bill was not about health care. It was about government control and government takeover, because you don't need 2,700 pages to talk about health care.
There are some people who would say, well, emergency room treatment is not the same as health care. That, I don't know, I think Missouri County has maybe 8 free health clinics, including the Volunteers in Medicine Clinic here in Wilkes-Barre. That had involvement from people from Geisinger and Wilkes-Barre, Wyoming Valley Healthcare System, who know about the medical situation in our valley, and they're saying that there are people who didn't have appropriate care, people with diabetes and ongoing health conditions. You're suggesting that those people do have access to care and could go to the emergency room?
Absolutely, if they go to the emergency room. Now, what they don't have is they don't have access to ongoing prescription drugs. And depending upon what their income level is, Pennsylvania funds Medicaid at 33% above the poverty line. So you get a white card in Pennsylvania. I call it the white card. You get an access card in Pennsylvania for Medicaid if you can't afford health care. That's standard operating procedure. So I don't know who those people are. That's what I'm trying to say. I don't really know who they are. Are they people who just won't go to the public service places to get help, and would they go to the doctor's office and sit in and wait? I don't know. I don't know the answer to that, but I think it's worthy to know the answer to that. But what I don't believe is that under any circumstance that the cost to provide what they're providing is $1 trillion, should be $1 trillion, which a lot of folks suggest, experts say, is really $2.5 trillion, because they haven't included actually paying the doctors 300 some billion more during that period, and a number of other things. So I don't know. I'm not there yet, but I'll tell you what, if I could see the books, I'd know.
Should you get there and find yourself elected and you're a Democrat, but your party's left you behind, and the rest of the party is part of the machine and you're not, how do you accomplish change?
By screaming bloody murder on a continuing basis. It's the best that I could do, by getting people, the constituents of those perhaps that aren't my constituents. If you look at my website, I'm suggesting that all 435 Congress persons are replaced, and I'm not dumb enough to expect that that's going to happen, but I do think that everything happens one step at a time. Nobody gets anywhere without beginning a process. And so if it's me this time, maybe it's some other Brian Kelly the next time. Maybe it's maybe across the whole United States, a bunch of Brian Kellys show up and decide that they want to take more of a role in their life and in the life of citizens of the United States, and they decide that they want to help. Maybe the politicians who are in office begin to get shamed by the people. If we could have a media that actually painted them the way that they treat their constituents, that would help.
Other questions from the group?
With the amount that you're spending against the amount that the other candidates are spending, what do you think? What's your projection on the outcome of the primary?
I think if I can reach people, and I'm not sure that I'll be able to, if I can reach people, I think they'll hear my message, and I will be the winner. If I can't reach them, then all I've proven is that a regular guy cannot run for office.